right. It looks like, okay, we have people coming in already. Will you give me a thumbs up, Dr. Rosa, if you can hear me?
We're
Okay,
good. I can hear you.
awesome. Okay. Hello everyone. Welcome. We're super glad you could join us today. As people are joining, if you want to go ahead and pop in the chat, let us know where you're coming from and what kind of practice you are a part of. Utah dentistry. Love that. We are in Utah as well. Colorado, so you're not far. Ogden, Utah. Okay, we have some people close to home here. San Diego. Oh, well, that's you.
Sorry to disappoint.
No, I was just gonna say Dr. Rose is also from San
Hey, somebody we know
Diego.
is over there. LA. All right. So we got our Southern California people.
Yeah. Awesome. Um, well, thanks so much. On behalf of the whole Weave team, I want to thank everybody for being here and taking the time out of your busy day. We know that you are all super busy, so we appreciate your time. If you do have any questions throughout the webinar, just pop them into the chat and I will be monitoring it so that we can get to those questions. If you are a current customer and you have specific questions about your account, feel free to email me and I will help direct you to the right person. But we can go ahead and get started.
Let's
Today's
do it.
session is all about AI. So we have Dr. Adam Rosa with us here today. A little bit about Dr. Rosa. He's from San Diego and received his bachelor's degree at Brigham Young University, Idaho, before moving on to graduate from the Southern California College of Optometry, where he was selected as a mentor to the current students there. Dr. Rosa started in the industry in 2007 and promotes the latest and most advanced technology in ocular health and vision science. He's actively using his knowledge to help his patients achieve the best vision possible. Dr. Rosa's fun sense of humor and excellent bedside manner make him a hit with all his patients. He's married, has 3 children, and as a family, they love to spend time outdoors, hiking, camping, and playing at the beach. So we have an awesome guest with us today, and I will go ahead and turn the time over to you, Dr. Rosa.
Awesome. Well, thanks, Carly. Uh, thanks for the introduction. Yeah. I'm stoked to be here with you guys today. Excited to share some of what I've learned over the last couple of years using AI in our practice. And if you're on this webinar, I'm assuming that you're somewhat techie, or you want to be, that you've tried to figure out how to use AI. And it's just like, how can we do more of this? Because it really is such a cheat code to making practice simpler, to growing your business if that's what you're interested in doing, or just facilitating the simplicity of it, offloading some of the stuff that you might have to do and letting another intelligence kind of take the load and help out with that stuff. So I'm excited to share some of the ways we figured out how to do that. And, hopefully it'll carry over into your practices and your clinics. So let me show you we'll boot up the presentation here that I've got. There we are. All right, so AI use in healthcare practice. And we've got a little table of contents here. We probably won't have time to go over all of these things today. We have about 15 to 20 minutes for me to share some of my insider info, and then we'll pass the torch back to Weave and let them kind of share how their tool can also continue to leverage AI to help your lives be a little bit easier. But the first thing that I found helpful is to really just go over some of the different AI platforms that we have out there, what they do, what they're good at, what they're not good at, and where they can potentially simplify your life. And I've attended as a learner a lot of these webinars over the last, I don't know, year or two, as they've started percolating out and becoming more and more popular. And one complaint that I not always, but often walk away with is a lot of them are like, where is AI going to be in 5 years? Where's it going to be in 10 years? How is it going to help us, in 6 months? Or what are the tools going to be doing, down the road? And that's really cool. It's exciting. It's fun to learn about. But I'm like, what can I do now, right? Like, what is out and available today that will make my life a little easier, that'll cut some of that work out? And so that's what I want to talk about. And I've tried some of the tools that are out there today, and besides Weave, which I think has some really exciting and cool AI tools that are ready now and others that are coming out in the very near future, a lot of the other ones that I've worked with just haven't quite seemed ready for prime time yet, right? Like there's some AI receptionists out there. The ones that I've played with and tested still just haven't quite been ready for me to spend money on them. There's some like AI charting out there where they'll listen to you and they'll try to put a chart together. It's really just kind of like, here's the document, copy, paste it, and you spend a lot of money for that. And actually, if we have time, we're going to try to show you how to do that for free in your own clinic, or nearly free in your own clinics today. So the tools that I found to be the most helpful so far are really still just the general artificial intelligences that you can train and leverage to do lots of different stuff inside your clinic. And the ones that we use the most in our clinic are these three right here. We've got ChatGPT, obviously, right? We've got Claude, Gemini from Google. Claude is from a company called Anthropic. And then the one that I haven't listed here that I don't use quite as often is Microsoft's Copilot. Some of you might have used that, some of you might not have. It's got some cool stuff that it does. I don't use it quite as much. So let's dive for just a second into what each of these three big tools is good at, and where you might be able to use them in your practice. So first of all, ChatGPT, right? I mean, this is the one that's got the most mature ecosystem. It's been around in a usable format the longest. It's got some pretty cool extensive third-party integrations, so it can now plug into like your Gmail and your calendars and things like this and start to do stuff outside of itself for you, which is pretty cool. You can create these specialized AI assistants that'll do different things for you. They're called custom GPTs. It does a lot of really cool stuff. When I think about ChatGPT, if I had to compare it to like people that I know in my life, ChatGPT is like, my older, wiser friend who's been in business for a while. He knows a lot of stuff about how the world works. And if I need that friend that just has great perspective and outlook, I'm going to this guy, right? That's ChatGPT. I'm going to ask him a question. He understands where I'm coming from the best, and he understands the best how to give me a usable response, right? So that's kind of ChatGPT. It's still probably the one that I reach for the most if I really need to use an AI day to day, right? Now, the limits of ChatGPT, and these are kind of the limits of all of them, right? But the free version of ChatGPT, you're going to run out of queries relatively quickly. If you're trying to have a conversation where you take it places and you really tease it out and get ideas flowing, you're going to bump into the cap, and it's going to say, hey, you got to spend some money to get further information out of this, right? So that's true of all of them. You can do some work. It's good to test it out and figure out which one you like the most. But once you decide which of these 3 or 4, if you're talking about Copilot as well, once you figure out which one you like the most, you're really probably going to want to subscribe to the plan and open up how much more work it can do for you, right? ChatGPT can slow down a little bit if it's during a peak time. It's gotten better lately, but you'll still, if there's a lot of people using ChatGPT, it'll slow down a little bit because it's still the most popular one, right? You can't build custom GPTs without the premium plan. And yeah, those are maybe kind of some of the limits of ChatGPT, right? So then we've got Gemini, which is made by Google. This one was kind of this, one of the earlier ones as well, right? Came out shortly after ChatGPT. Google, I think, had been working on this for a while, but ChatGPT beat them to the market. So Gemini is pretty awesome. It's got a lot of great integrations as well. Really plugs in nicely to your Gmail and your Drive and your calendar, your maps. It can do a lot of this cool stuff for you. When I think of Gemini as a friend, Gemini is sort of going to be my friend who knows a lot about a lot of stuff, because Gemini gets a lot of its training and information from the internet, right? So Gemini is built into Google search now. And you'll probably see this when you do your Google searches, like you type something in and Gemini's like, here's like some information from its web search. So if you have a friend that knows a lot of stuff, but because they're reading the internet all day, they're just online all day reading articles and things like that, that's like Gemini, right? So the advantage is it's got very up-to-date information. ChatGPT, you can ask it to search the web and it'll go out and do a search for you, but Gemini just does it by default, right? So Gemini is going to automatically include a lot of that stuff right out of the gate into its answers. So if you're trying to get really up-to-date information, for me, that might be like, what's the latest study on eye stuff, disease, pathology, treatments, medications, treatments, whatever. Gemini's going to reach for that information more quickly because it's just built into its search protocols. And I have to ask ChatGPT, can you look up the most recent stuff for me? I like that Gemini will also by default usually include sources. So these AIs, they'll still do what's called hallucinating a little bit. And maybe you've run into this where you ask it a question, it comes up with an answer. You're like, oh, that's a really interesting answer, not what I expected. And then you go look into it. You're like, wait, that's not true at all, right? So they're all still prone to doing that to a certain extent. Gemini is pretty cool in that a lot of the times it'll include the sources after its answer. So you can click on the source button and see exactly where it pulled that information from. So it's easier to fact check, which I think is important since so much of its knowledge comes from the internet and just what's been published out there recently. Most of these were trained initially on data that ended in the middle to end of 2024. And so they're going to, by default, grab that information. But Gemini will be a little easier to get more recent information. And like I said, chat can get there if you ask it to. Now, the downside to having that friend that knows everything from the internet is that some of the stuff that's on the internet is not true, right? So even if Gemini gets sources and it pulls those sources for you, you have to make sure that the sources are relevant and trustworthy, right? Like if it got information from Reddit, you're like, I don't know about that, right? So make sure that the sources you're looking at make sense. Gemini also has some really cool stuff in terms of what's called deep research. You can ask it to do deep research. It'll dive into like just research articles, and it'll put together a whole kind of assimilation, like assessment of all these recent articles and publishings. And then you can really get into like deep dive in science and medicine if that's what you're looking for. Again, it's limited in terms of what it can do on the free version. I put this in here, but it can analyze Excel and CSV files now. I've done it on the free version. Sometimes it likes Excel, sometimes it still asks for PDFs. So there's different ways to get it to analyze your information the best, right? And then last but not least in these three general AIs is Claude. So I find that less people are familiar with Claude. It's a little bit quieter. They haven't done quite as much, or maybe they just haven't latched on as well. But Claude, to my way of thinking, this is your friend who's really artsy fartsy, right? They're really good at taking stuff that you give them and turning it into a visual representation. So Claude can do all of the other stuff really well, like the other AIs do. But when I need something that is, I don't know, in a presentable format, I reach for Claude. And Claude will do that by creating these really cool things it calls artifacts. Point in case, this whole presentation that we're looking at here is an artifact that Claude designed for me. So when I was creating this presentation, basically what I did is I went into ChatGPT and I said, hey, ChatGPT, I want you to look back at all the conversations we've had in the last year that were anything business related, pull all of those conversations apart, give me bullet points for each of those. And so it created this whole list of ways that I've used ChatGPT in the last year. And then I took that list and I gave it to Claude. And I said, okay, Claude, now I want you to create a presentation. I don't want it to be a PowerPoint. I want it to be free flowing so I can click back and forth through different links. And Claude said, okay, here you go, boom. And I had to ask it to kind of refine and dial it in a little bit. But, you know, everything you see here, Claude just programmed it, it designed it, it spit it out. And I haven't found that ChatGPT or Gemini are quite as good at building interactive presentations the way that Claude does. So another thing that I've done with Claude in terms of building these tools is patient education tools, you know, certain things, diagnoses that I run into regularly in my clinic. I just said, Claude, can you build out an education tool? And it gives me a tool that's clickable. I can shift around and I can show patients, here's what it looks like. Here's the treatment. Here's what happens if we don't do anything. It's really good at designing these little artifacts that you can pop up and they don't have to load. They're usually web-based if you ask it to make them web-based. So that's largely how I've used Claude. It also has had really good focus on privacy and ethics. They kind of make this an underlying part of their business model. So I know a lot of doctors reach for Claude because they're concerned about privacy and that kind of stuff. Now, any of these, I'm still not giving them HIPAA sensitive information, right? But in terms of just protecting your privacy, your queries and things like that, Claude's really good at that. Just a quick little chart here that talks about you know, what these things cost. So this was updated about a month ago. You can kind of see what each of them will do for free. You can see the standard paid tier. They all cost roughly 20 bucks a month last I checked. And then there's a premium tier where they'll do even more stuff. You get even better processing. You can use more users. This is generally for really large organizations. So if you're in like a nationwide chain or something like that, this is probably where you want to go. If it's just you and a couple of your clinics, then you're probably fine with this middle version here. And of course, you know, you get to use this for your business, but sometimes it's also nice just to use this for home stuff as well, right? So those are your three general artificial intelligences. Now, just as a quick little disclaimer, like Copilot, right? So Copilot's built into Microsoft, and the ways that I'll sometimes use Copilot is if I have an Excel sheet, uh, I'll get onto Microsoft's online Office. I don't have Office downloaded on my computer anymore, like Word and Excel and PowerPoint. I use the online version that's all in the cloud. And so if I'm crunching Excel sheets and they're already in the cloud, I can just ask Copilot, hey, look for this data in the spreadsheet, and it's already right there in the spreadsheet. It'll just whiz through it, find what I'm looking for, and help me figure out the data. So sometimes I'll use Copilot for that, but a lot of the times I'm still uploading those spreadsheets into ChatGPT or maybe Gemini to kind of analyze and help me figure stuff out. How should you use these? Well, again, kind of as a little recap, ChatGPT is really good for creating custom assistants, which I think we have enough time to pop over and do that real quick right now. Automate workflows. Gemini, great if you already use Google Workspace, right? If that's something that you already have in your practice, it's really easy to tack on Gemini and it'll build into your Google Workspace applications and do a lot of cool stuff for you in there. And then Claude, like I said, the big thing I use with Claude are those artifacts. I think they're really cool. It's great at coding and figuring out how to code stuff for you in a way that's usable. And thanks to Claude, we'll just click right here and it'll take us all the way back up to the top here, right? So the next thing that I want to show you guys is how to build a custom GPT, which I think this is really where the rubber meets the road, right? Hopefully so far you've figured out maybe some of these are things that I can use in my practice, but this for sure is a way that I love using ChatGPT in my practice. And we talked earlier about how you can go out and you can subscribe to maybe like an AI that will do charting for you. So what we're going to do is if you have the paid version of ChatGPT, you can actually build that yourself. So we're going to come over here to my account, my ChatGPT account, and we're going to come over here to these GPTs. You can see I have a couple of them listed right here. These are ways that I've already built in some custom GPTs. We're going to go explore. And it's going to give us a bunch of GPTs that have been built by other users. You can go through these. These are like ChatGPTs where you're switching the hat, right? If you put a baseball hat on this ChatGPT, it's going to act like a baseball player. If you put a basketball hat on, it's going to act like a basketball player, right? So you can go through and you can find some really cool GPTs in here that have already been designed and do really custom, unique things. We're going to create one. So if we click create, now you're going to see two panes on my window, right? On this side, this is ChatGPT, and it's going to walk me through how to create a GPT that does what I want it to do, right? And then on the other side, it's going to show a preview of what that model will look like so we can test it and play with it. And we're going to start over here on this side, and we're going to see, let's see, I've got my headphones on. We're going to find out if it is able to listen to me, even though I'm plugged into Zoom right now. So let's click this dictate button for a second. Hey, ChatGPT, I want you to build me a scribe artificial intelligence. The point of the scribe artificial intelligence is to listen to my findings as a doctor and then go ahead and put them into a SOAP notes format that I can copy and paste directly into my chart. So I'm an optometrist and I run a private practice, and I need you to figure out how to just listen to my voice, let me talk about patient findings, and then put all of this into a really easy, clean format that I can just utilize and refer back to in the future. So we recorded that quick little voice memo, and now it's going to turn it into text, and we're going to send it to ChatGPT. And now what Chat's going to do on this side is start asking us questions, and it'll ask you questions for a long time, right? Like if you let it, it'll just keep teasing ideas out. It'll ask you stuff about how you want this GPT to function in ways that you might not have thought of. That's typically how it works for me. I have this idea, I want to build this thing, and it goes, well, did you think about this? Did you think about this? Honestly, a lot of the times I haven't. And so it's going to ask you how you want the data structured, how you want it to come out. And right now you can see it's thinking about it in the background. It's giving us a response. And on this side over here, it's going to start to pop up with potential responses and ways that it can do this for us, right? So we'll talk as the builder of your GPT, not as the scribe itself, right? This guy's, he's telling us, I'm just building this. I'm not the scribe yet. The scribe's going to pop up on this side over here. And it gives us a bunch of information about how it thinks it should be done and what it should do. It wants to give it a name. Yeah, that's fine. Whatever you want to call it is fine with me, right? We're just trying to get to a point where we can test it. So I'm going to really whiz through this because we're just about out of time. It's going to give a picture to our GPT, right? So it's coming up with an idea for how that picture should look. And now when you build multiple GPTs, you can just click on the emblem of the one that you know, or that's the one that I want to utilize. And so it's going to come up with a little picture for us over here in a second. Oh man, apparently we hit it during peak usage time. Normally it's pretty quick with this kind of stuff. Well, once it figures out how it wants to show the graphic to us, we're going to be able to come over here onto the other side. Man, it's really taking its sweet time. Let's have it just skip that. There we go. Okay, so when we skip the picture, it has an idea now. It's calling itself Optometry Scribe. Normally it'd put the little picture right here. And, just to test what we have so far, which took me, 1 minute to build, and it's going to be really rough. But if I came over here now and I gave this a case, let's say I had somebody that came in with an eye infection, and I put over here, hey, I have a patient in my chair who has signs of a bacterial eye infection. I'm seeing papillae in their inferior fornix and inferior palpebral conjunctiva. They've got 2+ hyperemia. I'm seeing 2+ discharge. I decided to put the patient on a broad spectrum antibiotic. We're going to start them on Ocuflox. It's going to be 1 drop in the left eye 3 times a day for 1 week. And I want them returned to clinic at that point for further follow-up and evaluation. So let's see what it gives us after just really barely touching that at all. It's going to take that, hopefully crunch that information and turn it into some SOAP notes format. There we go. There's our assessment. There's our plan. Again, pretty basic because I didn't take a lot of time to build out the AI. But if you spent 5 or 10 minutes doing that, it would give you the structure exactly the way that you want it. It'll ask you questions about all of that stuff. And now you just copy paste it straight into your chart, right? So instead of paying for a custom AI to do this, if you just have a subscription to ChatGPT, it's going to do a lot of the stuff for you, which is pretty cool. All right, so I think we're starting to run up against our time limit here, and I'm going to go ahead and pass the torch back over to Weave. They got some really cool AI tools built into their system already that are getting better and better as time goes by, and they've made a big difference in my clinic. I'm confident they will also make a big difference in your clinics.
Thank you, Dr. Rosa. That was fantastic. Everybody give it up for Dr. Rosa. I know I can't hear you clap, but everybody just clap wherever you're at because that was absolutely phenomenal. I've learned a ton, and I think these are really, really good tips for everybody to implement. And when you're talking about implementation, kind of like you've mentioned, we're looking for ways that we can implement AI in our practice right now, right? And one of the ways that we can do that is through Weave. So I'm just going to give you guys a quick 2-3 minute demo. I want to talk to you guys about just a couple of different things that we've got going on here at Weave. I'm going to go ahead and take over for you, Doctor. All right, you guys can see my screen okay. So this is what Weave looks like when I open it up. And you can see that you're going to have a dashboard right here. So you may have heard about our call intelligence. And the way that I think of call intelligence is kind of like you were talking about earlier. It's an AI tool that's kind of like a consultant where it's going to help me analyze my phone calls and make sure that my staff are really at the top of their game and that I'm monitoring for quality, right? So the first thing I'm going to see here is a call intelligence dashboard. I can see here on the side that there's going to be a call summary here. It's going to have an analysis of the call that's going to tell me if it was a scheduling opportunity, if that converted, and all of this is done by the call being recorded and then analyzed by AI. And one of my favorite things here is it's actually just going to give me a full transcript too. So if I want to go back and reference something, I can go ahead and look at it right here. And then down here, you're also going to be able to see tasks that were generated. So after this call, the tasks that I agreed to, where I have to hold this consultation slot and provide a pre-consultation, okay? We could talk about call intelligence forever, but call our friends here at Weave. We can get on with you and actually do kind of a more custom demo. We can show you what this would look like in your office and how to implement it. Now, if we go over here to reviews, everybody gets reviews. You got to be responding to your reviews. It's what's going to make you look great. And we want to make that a little bit easier for you here at Weave. So I can see that I just got a review from Alec over here. And what I can actually do is I can press this Weave AI button. Now, anytime you're in Weave, AI is going to be represented by this little constellation of stars. I kind of dig it. I'm a big stargazer. We live out here in Utah. I like going to the national parks and going to see the stars. And so that's kind of how AI is represented here. What it's going to do is it's actually going to write me a review response right here. And if that one's too long, I can shorten it up. It makes it a lot easier to respond to those reviews. You can edit it too, but it really takes some time away from that process. Then the last thing I'm going to show you here before I turn it over to Matt to talk a little bit about TrueLark, which I'm super excited about. is our email campaign feature. So most of us are sending emails. When I go in here and create an email, I can actually use Weave AI to help me create that content. So if I create a new email campaign here, I can actually, again, click that Weave AI button. And I can say, go ahead and make me an email campaign. Let's focus on patients who are overdue by a year, and we're having an amazing special. Super vague. Obviously, you'd want to give it more detail than that to make it relevant to your practice. But you can see it's going to type up the entire content for me right there. And what I can do is I can also shorten that, give it another try, and then I can insert that right into my email campaign. It makes it super easy to send out those email blasts to your patients. And with Weave, since we're working with your practice management software, we are also able to do some cool stuff with demographics and customization. Again, talk with the team here at Weave. We'd love to show you how we can help implement AI at your practice, but these are things that are available today that we spent a lot of time on, and we feel like they're going to help your practice out a ton. So that is all for me. I will go ahead and turn the time over to Matt to talk a little bit more about our agentic AI solutions.
Thanks, Adam. That was great. So let me kind of show you over to our new TrueLark AI tool. So this is our first kind of messaging and AI receptionist tool that we've created for Weave. The big thing about this is it's able to communicate with your guys' patients while you guys are either out of office or maybe when you guys miss a call. Office or patients can also directly text you guys, or they can even chat online or book through a line with the AI. So when somebody engages with the AI, they'll be able to enter in their information they want to receive text from, or if they directly text you or give you guys a call, the AI will automatically respond to them. It'll engage in a two-way conversation with them, and it can actually go through all the way to scheduling appointments, rescheduling appointments, and canceling appointments. It can also build new patient profiles into your guys' practice management software, and it can also help them understand which insurances you guys take, or if you wanted to collect certain information before somebody can fully book. This is very helpful to be able to see, if you guys have a lot of missed calls during office hours or maybe after hours, a lot of those missed opportunities is something that you guys will have to follow up on or potentially miss out on. So the AI will be able to reach out to those people and communicate with them while you guys are either busy with your guys' current patients in the office, or if you guys are just out of office. So you can see kind of different engagements with the AI with different patients in here. It'll give them real-time availability for the patient to schedule with. And it can also answer basic questions. And you guys can train the AI a little bit to kind of tell the patients what you guys accept, or if they have certain questions and stuff like that. If the AI needs assistance from the office staff, it'll forward the message over to the office. So that way you guys can seamlessly just take over and get that patient taken care of. So that's Weave's AI feature. It is called TrueLark for AI Receptionist. And then back to you, Carly.
Awesome. Thank you, Matthew. Great question. So somebody is asking if we have this technology for the field of audiology.
So currently right now we have 3 practice management softwares we fully integrate with. Those are OpenDental, EagleSoft, and Dentrix.
On the Weave side, the stuff that I was showing earlier, Weave is absolutely compatible with audiology, and we love our audiology practices. A lot of patients that are experiencing hearing loss really enjoy the texting capabilities of Weave, and it's actually been a really, really powerful tool for our audiology practices. And so our hope is that the TrueLark features that Matt talked about are going to be available in the future, but for right now, Weave is definitely compatible with for audiology. I'd love to have you.
And another question, at the end of the day, are we able to review all AI conversations to ensure accuracy? Yes. Adam, if you want to touch on that in relation to call intelligence.
Yeah, for sure. I think the biggest thing that we are trying to educate people about in terms of working with an AI model, it's like bringing on a new employee, and you need to train the employee, right? And so AI is something that you have to continually have that relationship with, and if there's something that's not quite the way that you like it, give it that feedback, and it's going to continue to get better. you're joined by the power of, like power, that sounded tacky. There's a lot of practices around Weave that are informing these models and helping them get better every day. But you're absolutely able to check it and monitor for accuracy, so you're improving your model.
Okay, well, if there's something that you forgot to ask, feel free to email me. So if something comes to mind, feel free to reach out. Happy to answer any of your questions or get you connected with the right people here at Weave. Thank you all so much for joining us. This will be sent out via email, and have a fantastic rest of your day. Thanks so much.